I'm Peter James, consultant orthopaedic surgeon with a particular interest in managing hip and knee pathology, particularly arthritis. A large number of patients with hip and knee pathologies come along. On the hip side, largely just arthritic condition, where treatment strategies can include conservative treatments such as physiotherapy, advice, analgesia, hip injection and ultimately hip replacement. My major area of interest, however, and specialty is around the knee. Again, big interest in managing knee arthritis and related conditions, including meniscal tears. So patients come along, usually complaining of pain in the knee, often mechanical symptoms as well, that their knee's giving way, it's catching, and it's locking. And those are really the big reasons for attendance. Again, at the knee deformity as well, it's changing shape or the legs changing alignment can be a reason to come along and attend. I think it's important patients get reassurance, so patients should always feel happy to come for an appointment, even if the condition is in its early stage. Very often reassurance, advice, help and just a simple explanation of what's going on in the joint is sufficient to reassure that individual patient that there's really nothing to worry about. Clearly, as symptoms progress, then I think more patients present themselves for an opinion. It's important, I think, as consultants that we put the patient at the centre of the treatment strategy and the management plan so that they are really involved in all of the decisions that we make. Try and give them a full explanation of the pathology, the implications, the long-term prognosis, as well as discussing with them the varying options available for management. And when we've reached that point and we've investigated and made an assessment, then I think it's important that the patient makes the ultimate decision about how they want to proceed with treatment. And it's important that we spend some time with them explaining that treatment can often be a cascade, that we can start with simple measures, low harm, low risk, and assess the benefit of those treatments and make a decision whether the patient's improved to a point that they can live with their symptoms or manage their symptoms in a satisfactory manner. But reassuring them again at that point that if we don't make progress with that simple intervention, then there are other steps we can take to get them to a level with which they are happy and a level that they can function with a good quality of life and minimal discomfort. I think it's an important part of our role as consultants to make it clear at the outset that we're there to give advice and reassurance, and very often that's all that's required for patients. Just by coming to see a surgeon doesn't mean to say that they're destined to have an operation. There are other treatments that we can offer which are carry much less risk, often can be done as part of the outpatient consultation and have a massive impact and benefit for their symptoms. So not everyone who comes to see us requires an operation, needs an operation or has an operation, but clearly it's an option if the condition demands that line of treatment. In orthopaedics and particularly joint replacement surgery, outcomes are measured in a number of different ways. So we get personal feedback and feedback from patients who have been under my care at this hospital as well as in the NHS is invariably good. But we also get more objective feedback in our specialty from the National Joint Register and from the National PROMs, which is patient recorded outcome measures. I do large volumes of both hip and knee replacement, as evidenced by those data banks. My revision rate and redo and failure rate is very low compared to the national norm. Therefore, I come out as having good outcomes in terms of survivorship of the implant. And the recent publication on patient-reported outcome measures shows that my outcomes are better than the national average. So. It would be what we would term as a positive outlier. So outcomes in the top 5% of surgeons in the country as reported by patients individually and out with my input. So that's done remotely, so I had no input into their assessment of me as an individual. Most patients who come to see me who need an operation have debilitating pain, often disturbs their sleep, and their activity levels are significantly restricted, so they can't do simple things like walk with their family, and hip arthritis, put shoes and socks on, and other such things which we all take for granted. And one of the most gratifying things, I think, as a surgeon, when you put them through what is major surgery, is seeing them back in clinic post-operatively when All of those difficulties they experienced before the operation, now they can start to do again. So seeing patients lose their pain, they look better when they come back to see us because they've lost that haunted expression that people have when they're in chronic pain. They can start to walk again, so simple things like walking their dog, they're doing again. Going out with their family for Sunday walks and whatever. Again, doing it without pain, without needing to think, am I going to be able to achieve that? And it's those simple little things, those improvements that we give to people after hip and knee replacement that really makes what we do seem worthwhile. So I've worked at the Park Hospital since I started as a consultant in Nottingham in 2000, so that's 20 years now. I've been coming to the Park Hospital. It's the only private hospital I come to out of all the others in Nottingham. And that's largely because all my patients have enjoyed coming here. They feel well looked after. As a surgeon, we're well supported here by excellent staff that work alongside us. It's got an excellent safety record and satisfaction scores. And all in all, it is an excellent hospital in which to work, but more importantly, it's an excellent hospital for patients to attend for high quality treatment. The most enjoyable thing is just, and it sounds, I guess it sounds a bit corny, but it is just helping people get better. Seeing the transformation from their preoperative condition or their condition when they first present to the improvements that we can deliver with simple and more complex intervention, but restoring quality of life and just taking pain away is really quite rewarding.